So I'm Fadi Charbel. I'm the head of the Department of Neurosurgery at the University of Illinois in Chicago. And I work there full-time as a neurosurgeon and also have a research lab that's been ongoing for many years. So what NOVA is a technology that utilizes MRI, which is completely non-invasive, 100% safe method to not only image the blood vessels of the brain, but provide us with something very unique, which is a measurement of the blood flow quantitatively that goes through the blood vessels. So previous to this, we would look at an image, say of a blood vessel. Say someone comes in with a stroke. We want to see if there's a blockage and if the blockage is significant. So get an image, any kind of angiogram, MR, CT, etc., ultrasound, and we'll get an image. And then we can look at the image and infer with our mind that there may or may not be change in the blood flow. With NOVA, not only we get an image that is better than any other image, which is safe because it's MR, doesn't use contrast, but we also can measure the amount of blood going through it. And what that allows us to do is to diagnose the problem accurately, know if we need to treat it, and then once we decide to treat it, whichever treatment we use, sometimes treatment is medication, sometimes it's surgery, sometimes it's a stent, or etc., whatever it is, then we can follow the treatment and know whether the results were what we want them to be. And this is a technology that uses no contrast. So it is safe, it is 100% non-invasive, it is repeatable, so it can be done again and again to test your treatment, and it's quantitative, whereas it gives you an actual number. So these are the main points of why this is unique and why it's so relevant to what we do today. This is particularly relevant for neurologists that follow patients with potential stroke or at risk for stroke, because today the treatment for stroke is not very clear. There are many things that can be done. The question is, should they? And if done or not done, what is the benefit? So what we find is that neurologists in particular are absolutely fond with this approach because it provides them with a measure of comfort, a measure of certainty as to whether the problem deserves a treatment, and if you engage on a line of treatment or another, how's that progressing? And you can do that with NOVA in a non-invasive way with real numbers. So the reason neurologists like it is because they're trained to think very, very rationally. And the fact that you have data, which is what we want, this is a new era of quantitative medicine. That's where we want to be. And neurologists have really been at the forefront of this. So neurologists and stroke neurologists are very fond of this approach, and it resonates very, very easily with them. So I am delighted that this technology is now going to be available at St. Joseph's Hospital here in Tampa, in Florida. This is, to my knowledge, one of the very few hospitals on the southeastern coast that has it. And it is befitting because this is a large institution. St. Joseph is a referral center. It's a large hospital, 1,000+ beds, with all the state-of-the-art technology and a team of physicians, including interventionalists and other physicians, neurologists, so forth, that can benefit and that can make this available to your patients. So I really, I'm very happy that this is available here. I think a lot of good is going to come out of it at your institution at St. Joseph Hospital, and that this is going to be a great asset to the community.